In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's going on, everybody? I just want to cover what's going on here with COVID down south here. Just to kind of give you guys a little bit of an overview of what's been happening ever since pretty much the beginning of January. It looks like Arkansas keeps breaking records almost on a every other day basis. As of January, we have twice as many known active cases of COVID-19 as we did in January of 2021. And even more than that from when the pandemic first started in 2020. So we hit 10,974 cases, and that was just positive cases. That wasn't the admissions. But here locally, here in the state, our admissions have pretty much broken the system. It's being reported all over the place. I don't know if you guys are getting in on a national level. I'm not sure. I haven't seen it because I've been working it. But here's another one here. Breaking: Arkansas has seen the largest single-day rise in COVID-19 cases since the pandemic began. According to Governor Asa Hutchinson, new cases rose by 10,974. Okay. I'll go down here and we're going to take a look at what we're seeing here. And I'll let you guys listen to this little piece here.
Northwest Arkansas have opted to temporarily go virtual as they navigate this spike in Omicron. However, Governor Hutchinson encouraged the continuation of in-person learning in schools. Right now, schools are limited to 10 days of alternative methods of instruction, such as shutting down to go virtual. Those days do not have to be made up at the end of the year. Today, Secretary of Education Johnny Key said they are continuing to monitor the situation and will inform the governor if further action is warranted. Governor Hutchinson stressed the importance of keeping instruction inside the classroom.
It is critically important for the well-being of our young people, for their mental health, for their development, for their education, and for the stability in life that in-classroom instruction provides.
Now, we did reach out to the ACHI for comment. They told me they do stand by their recommendations. And coming up tonight at 6, how the state is trying to meet the increased need for those COVID tests. Reporting live, Cole Zimmerman, 4029 News. Some schools.
All right. Okay. Basically, it was a little brief overview of what's kind of going on. Like I said, what was this, like a year ago, maybe 2 years ago now, we did not maintain the mask mandate. There have been lawsuits the whole time since that started about keeping the mask mandates at bay, keeping kids from wearing masks and whatnot. And, now we can see that basically that was a mistake that I called 2 years ago. So here we are trying to keep at bay these numbers. And we have a situation where we are that we didn't have to be in, essentially. But I'll go ahead and I'll read this story here for you. It's kind of short. It says Governor Asa Hutchinson rejected the nonpartisan health policy group's recommendations Tuesday as Arkansas activates active cases of COVID-19 have doubled in the past week. Monday, the Arkansas Center for Health Improvement put forward several recommendations in response to the spike in cases. The ACHI is a nonpartisan health policy and research center that works with Arkansas schools and hospitals as well as the state government. Shelter-in-place disagreement. Among those recommendations was advice to Arkansas families that unvaccinated children need to shelter in place. Children under the age of 5 are not eligible to receive the vaccine. We can't argue for shelter in place for families with unvaccinated children, Hutchinson said, saying that many healthcare workers have young children. Can you imagine if you've got a nurse that is told they need to shelter in place because they have no unvaccinated children? Oh, because they have unvaccinated children. We need these people in the workplace. We need these people in the healthcare facilities, he said. We cannot be sheltering in place and considering that as an option. The ACHI also recommended that seniors and families with members who are not immunocompromised or at risk because of health conditions such as heart disease, lung disease, diabetes, or cancer also shelter in place. In-person learning. Additionally, the ACHI also called for virtual instruction for schools in districts with 100 or more new known infections per 10,000 residents. Hutchinson said Arkansas cannot shut down in-person instruction, saying it is critically important for children as well as mental health development, education, and stability. Public interaction. ACHI called for suspension of public interactions or implementation of virtual options where possible in cities, businesses, and churches. You can't stop living, Hutchinson said. You can't call for suspension of public interaction. That's not where we are in our society today. That's not what we need to do to get through this. Okay? Hutchinson outlined steps the state government has taken in response, including increasing hospital capacity. It has begun to distribute at-home rapid tests for COVID-19 across the state. Arkansas received more than 200,000 tests from the federal government. The test is being made available at local public libraries, public health offices, and other locations. The best solution is to get vaccinated, Hutchinson said. Although vaccination does not guarantee a person won't get COVID-19, it can greatly lessen the odds of contracting it and being sent to the hospital, Hutchinson said. Well, it does more than that. And that's part of the problem. It mitigates the symptoms, which means that the sickness is not as bad, which means that you and more than likely will not have to go to the hospital. It also ensures that you more than likely will not have to need more invasive treatment and aggressive treatment for you to get over the disease. So that is one of the common misconceptions that people have out here. Well, why should I get the vaccine if people are out here getting it anyway? Well, because you don't want to be one of the people who are in a situation, an intensive care situation for 3 months, and not a lot of people are going through that when you look at the statistics on a national scale. But if you look at it on a small state scale, it's a lot more than what you think, and we'll get into those numbers here in just a second. But here again, we see that the governor at every turn is basically disregarding health information in order to health recommendations in order to keep everything open. He didn't support mask mandates. He didn't support vaccination at first. So in order for you to have a leadership position, you have to be a leader. You have to go out, step out front. You can't wait after the fact and make a decision and call that leadership. So based on recommendations, which I am in agreement that we can't close things down, but when we did close things down, we should have been a lot more aggressive with regard to wearing masks, with regard to supporting the scientific information that was out there, instead of taking the position that politicians were taking based off of whatever they were going off of, but it wasn't based off of medical science. Of that, we can be sure. History will not be kind when looking back on the initial efforts by certain individuals in trying to stem off what was initially happening. Okay. So, and we're seeing this all over the South. We're seeing this, these huge numbers in places where people, where unfortunately, or fortunately, however you want to look at it, but these people are usually people who are just not in full support of efforts to try to lessen the severity of the disease or the virus and its spread. So take a look at the next story, and we'll let this one run, and then we'll talk about this one.
Right now, we know Arkansas is trying to distribute its current supply of at-home COVID tests.
Yeah, for more on how you can get your hands on those today, 4029's Lydia Fielder joins us live now from Rogers. Lydia.
Yeah, the city of Rogers is handing out these home tests to people today. There are two ways for you to be able to get those. The first is here in a drive-through setting at the Rogers Fire Station #1. And there's also going to be a delivery service for those who maybe have mobility or transportation issues. Now, you do need to register to have firefighters deliver the test to your house. You can find that link over on our website, 4029tv.com, but there's no registration required for the drive-through. You can just show up, but people are limited to 1 box for themselves and up to 3 for their families. The city says they do want to make these tests a priority for at-risk families. The governor's saying right now Arkansas has on hand just over 600,000 of the 1.5 million tests ordered for the entire state.
It's the honor system. We do have the rules of limits on how much each person can obtain and how much each family can obtain per visit, so we can get them fairly evenly spread out.
Now keep in mind there are 2 tests per box. The drive-thru opens at 9 o'clock this morning and it'll run until all those tests are gone. Reporting live in Rogers, I'm Lydia Fielder, 4029 News.
Okay. There's a little snippet of that. Okay. So Arkansas set a record for the highest number of active cases at 71,134. This is more than twice the peak of the worst wave Arkansas experienced, which was in 2021. The number of known infections never passed the 30,000 mark during that wave. Okay. So I think it's no coincidence that they're only going back to January 2021. Because if you go back to January 20, it looks bigger. So we were shut down when we only had, maybe 500 cases. We were shut down. Okay. We got 10,000 cases. Well, had 10,000 cases, but you'll see what we're at on a daily basis in just a second. So here we go. We've got Arkansas now has as many cases of COVID-19 as it did in 2021. Here's the scale there. And it shows, us and where we were and where we are right now. Doesn't look too hot. So, as you can see, we're up and up and up here. You know, that was as of the 12th. Okay. Okay. All right. This is the 18th. We had 3,213 cases on that day. You know, we had 88,938 of total active cases. Okay. And we had 9,452 deaths. That was plus 15 on that day. Okay. Now, here are the admissions for that day. 67 admissions. Total currently hospitalized are 1,487. You can even see on this side how many they have in correctional facilities. And they have it correctional community. You know, and they have it by counties here on how many people they have. And those are not small numbers, okay? And this is not a big state, but you got all your numbers here. Now they start putting vaccinations in there, but they didn't used to put vaccinations in there because we're one of the lowest vaccinated states, because most of the people here are non-compliant. If you go around in the public, if I was to film out in the public, the numbers of people with masks on are relatively small. And, well, I mean, this is a red state, you know, and this is what's been pushed by, you know, pretty much everybody, every politician around is pushing that. So, Governor Hutchinson has kind of peeled his back. He's a little bit softer with it, but pretty much in the same direction. So that's the 18th. Okay. And there's 171 people on ventilators and one came off. Okay. Now your average emergency room has about maybe 10 beds, 8 to 10 beds. Your ICUs probably have about the same number, you know. And each one of those has to be manned by specially trained nurses, you know, and ancillary staff and physicians. And staffing is an issue. Nobody's really talking about it because nobody really wants to talk about it, but staffing is an issue. And he talked about it a little bit in the last one, how he didn't want, you know, nurses to have to shelter in place because their kids or this and that. But, you know, an exception could be made for healthcare workers. The exception is actually already made. We already know that we occupy a special status. So a lot of things that apply to other people don't apply to us. We have to come to work anyway. Rain, sleet, or snow, we're there. We have to be there. So, and we learn that in school, you know, same with doctors, same with police officers, firemen, everybody knows that, you know. So let's move up here. That was the 18th. Move on up. Okay, here's a story here on the 20th. Arkansas hit a new record of COVID-19 hospitalizations Wednesday, and top health officials worry for the future of the healthcare system in the state. There you go. Now, here's another thing that you know, I keep harping on, you know, and I'm still telling people this, and I'm still seeing people that I know who are getting sick, who are sick and can't understand, didn't want to get the vaccine, and they're still sick. Well, people who got the vaccine are sick. And here's what the vaccine does. They still don't understand what the vaccine does because they're getting their information from places where people are telling them everything under the sun. Vaccines reduce the risk of COVID-19, including the risk of severe illness and death among people who are fully vaccinated. That's what the vaccine is for. Okay. Okay. And this talks about how everybody's trying to get everybody in the state almost tested to try to get a handle on how many people we actually have who are infected here. Okay. So let's move on up. And that way I can show you guys the numbers. Okay. And I purposely went down to show you guys the span and show you how it was stretching out from day to day. Okay, here's the 20th. From the 20th, we went from 10,000 to 11,160. Okay. Here is the current hospitalized, 1,640, and that's plus 40 people are admitted. You got 187 on ventilators. Okay, 5 people came off. Okay, total active cases, 97,629. Total deaths, 9,470. 8 people died on that day. Okay. $11,000. Okay, 11,000 up from the other number the day before. Okay, so let's move on up. Okay. They skipped over some days and we didn't get the numbers. So then we went on the 25th. Okay. Currently hospitalized. We got 1,785. That looks like, and that's a drop of 32 people from the previous day. Okay, 233 people on ventilators plus 18. So they got 18 more people on ventilators on that day. Okay, here we've got 7,943 cases, 749,824 total cases, total active cases 89,572. Okay, 3,000 have dropped off from that. Okay, so you got big numbers that are swinging up and swinging down here. And, some people may think that's not significant, but it's significant, especially when you gotta work that over long periods of time. Okay, that was the 25th. Okay, we didn't get the 21st. Here's the 21st here. The 21st went up to 13,073 people. Okay. 1,658 hospitalized, plus 18, 195 on ventilators, plus 8. Okay, 101,141 active cases. I'm not going to even go over that. Okay, we got 9,484 deaths, plus 14 people died on the 21st. Okay, so 23rd, 3,000 people. Okay. 100,797 active cases, 1,779 were removed from the active case status. 12 people died that day, 9,510 deaths total. 196 people on ventilators, 11 came off. 1,633 hospitalized, 126 went home. Okay. Now we're going up to the 24th. I know this is kind of out of order, but you can see where this is going. I mean, we're getting 3,000 people at a time in little spats here. Okay. All right. So here we go with the 24th. 93,314 total active cases. 7,483 were removed from the active case status. Okay. We had 9,532 total deaths. 22 people died on the 24th. Okay. Oh, did I tell them about the ventilators? Oh, 19 people on the ventilators. 1,817 people hospitalized. That was 184 added to that hospitalized number. 215 on ventilators, and 19 were added to that. So 19 people went on the vent that day. 19 people got worse or came in terribly. Okay. All right. On this day, on the 19th, that's when we hit 1,600 admissions. That's on one day. We had that many admissions. Now, if you can imagine what that'll do, we got here in the capital, we've got, let's see, we got Children's Hospital. We've got St. Vincent's. We've got Baptist. We've got Baptist North Little Rock. Got St. Vincent's North Little Rock. Children's Baptist, St. Vincent's, UAMS, Baptist North Little Rock, St. Vincent's. That's six hospitals. All six of those hospitals couldn't handle that many patients. So that was a tough day. Okay. And there's the statement on that day. Arkansas has reached yet another record COVID-19 hospitalizations. Both UAMS and Baptist say they are at their peak. Looking at vaccinations, the ADH, okay, well, the vaccinations, unvaccinated. Okay. Reports 68% of inpatients are this is significant. Looking at the vaccinations, Arkansas Department of Health reports 68% of inpatients are unvaccinated. 29% are fully vaccinated, and 3% have also received a booster. So 68% of those people that are in there that are in bad shape refuse to get the vaccine. Okay. There's the 20th again. Let's move on up. There's the 22nd. I don't think we covered the 22nd. The 22nd moved up to 8,118. Okay. And here you see damage control. This is the lowest increase in hospitalizations since Christmas. This upcoming week will tell us what February will look like. Listen to your trusted medical professionals and get the vaccine and the booster. Okay. This after, a period of, oh no, we don't know what we should be doing. And, when we could have initially headed off a lot of this. Okay. But you guys take a look at that. Don't take my word for it. You can look at the coverage from the beginning of this all the way to the end of it. It's all on record. Okay. So there we have, we had 102,576. That's plus 1,435 active cases. Had 14 people died on that day, on the 22nd. 9,498 total deaths. Okay. 1,659 currently hospitalized. One person added to that from yesterday. 207 on vents, and there were 12 that were added to that number. Okay, so that's 22nd. Let's move on up. There's the 24th. Okay, went to 3,243. You guys see the number there. 215 on ventilators, and that's 19 added to that. 1,817, 184 hospitalized. Okay, so every day you're getting 100 people, or so that are having to be hospitalized, but your capacity is only so much. Okay, So that's where we are right now. So we've hit 14,000, 11,000, 8,000, 3,000. We're not getting under, 3,000, that 3,000 number, but you see those numbers. And all you got to do is just go and look at the updates for that state, or for any state for that matter. And you can see any state that's having trouble, and you can go back and you can see those numbers, but that's not sustainable. There's no way that we can continue to put people into the hospital and be at capacity. I can tell you that we were testing a couple of days ago. Got a few people. Tested again yesterday, and 10 people right off the bat. Okay? And these people were with other people. So the people that they were with, that didn't test positive, they're going to pop later on. And for every one person, you may get anywhere from 2 to 3 people off of one person. So that's what you're looking at. That's why you're seeing this almost like a domino effect of people who are around each other. I drive around, there are places for kids, trampoline parks and skating rinks and stuff around, ice skating rinks and stuff around where I live. And no one's wearing masks. No one's wearing masks to get gas. No one's wearing masks to to do anything really. And when you wear a mask, people are looking at you like you're crazy. Even if I'm in my scrubs, people are looking at me like, which side are you on? You know what I mean? That's kind of what you're getting. I'm talking to friends, even in other states, and people are who I've talked to personally, who are saying that basically, they had an aversion to getting vaccinated, and they're not going to get vaccinated. Well, they're sick. Their husband is sick. The kids are sick, and they're saying, "Oh, we're okay," but they're not okay. So they're trying to save face, and in the midst of trying to save face, and not telling people how sick you really are, you can put yourself in danger because you weren't listening to good information. You've been listening to bogus information. Now you don't know what to do when you get in trouble. So that becomes a problem. Imagine a system that's bogged down with overflow, the transportation system. You're going out in EMS trying to go pick people up, and you don't have enough trucks to go pick people up. You're trying to transport people to hospitals, and you're getting diverted because all the emergency rooms are full. And even when they're full, then they don't have a chance to divert. They just stick people in hallways until they can get to them. They fill up the rooms and then fill up the hallways, and there are people in the waiting rooms. Those people could potentially, not be sick as well. That they've got to see. So, if you can imagine that, and imagine that we all have a responsibility to try to, lessen the flow, at least. If people are going to get sick anyway, at least, do what you can to kind of lessen the flow, because there's only so many of us. There's only so many of us, and there's only so much that we can do. And I'm going to tell you, after you've worked so much, you're occupying a space. So, think about that. Think about your families, and like I said, or like I always say, you guys get good information from reputable sources, from people who care and who aren't just out here trying to make a buck off of you. Okay. All my best, people. I appreciate everything, and you guys listening to me, and hopefully, I did some good with this, and I'm just trying to tell you what's happening out here. You do with it what you will. It is your choice as to whether you do get vaccinated or not. I don't, hey, it's up to you. I'm going to have to treat you one way or the other, whether you're vaccinated or not, but, you're going to determine the path that you have to walk, so that's all I can say, and like I said, I wish everyone well, and hopefully we all get through this thing, and however it turns out, because who knows at this point. We're going on our third year. So good luck, everybody, and thanks for hanging out with me.
I feel like a